So heart failure is such a serious condition. It's very common, and there's been a concerted efforts among stakeholders to try and control the levels in the country. So at Karen, we do quite a bit. We have the heart run you're talking about. We run several clinics. We run a dedicated heart clinic in the hospital itself. We see on average about 80 patients a day. Majority of those, not the majority, about a quarter of them will have established heart failure. The remaining, about a quarter of them again will have hypertension, which we'll talk about as a major risk for heart failure. The remaining about half of them would have conditions that if not treated will actually eventually result in heart failure. So you see it's actually the entire clinic is all about heart failure if you think about it, the different stages of heart failure. Then we have satellite clinics, most of them are in central Kenya, so we have in Nakuru, we have in Meru, we have right here in Thika. Those clinics, we run a clinic every week, and we see 2-day clinic every week. And we see about 120 patients in those clinics. And again, the proportion will be the same. About a quarter of those will have established heart failure. The remaining ones will have risk factors that, if not treated, will eventually result in heart failure. So it's a major problem. Worldwide, we have about 64 million people that have been recorded as having heart failure. In Kenya, we may not have very concrete data on how many patients we have. But similar to Karen, the other places are reporting similar numbers. So we know it's a growing problem, increasingly growing problem that needs to be addressed.